Well, we all know that brushing our teeth twice a day keeps the cavities at bay, but what about floss? Tell the truth, people. How many of you are actually doing it daily? Dr. Jeanie Luong is here now to help us brush up on our flossing technique. I don't even know if I want to admit it. Jeanie, welcome.
Hi, Tracy.
So some of us are flossing, maybe not as regularly as we should, and some of us are not flossing at all. Am I right?
It's true. Flossing is essential to dental health, but many folks are skipping it.
Okay, so what happens if, we get a little lazy and we're not flossing every single time?
Well, if you're not flossing, flossing makes sure that you get all the food particles that your toothbrush can't reach. And if you don't floss, eventually you can get bad breath, loose teeth, and they can even fall out.
Okay, so that's all bad news.
Nope, yep.
And none of us want that.
Nope, we don't.
I'm gonna keep it 100 and say I'm very good with the brushing. I will always brush every morning and brush before I go to bed. I don't feel good going to bed with a dirty mouth.
I like what I'm hearing so far.
However, the floss, if it's been a long day and I'm super tired, I'm sort of whipping through the brushing routine and maybe I'm not flossing if I skip every once in a while. What's the news on that?
So I'll be honest with you. If you skip once in a while, it's okay.
Hallelujah.
Don't tell anyone I said that.
Okay.
However, the most important thing is having it a part of your regular routine.
Yeah.
If you're doing it often, that's the most important part.
And it's like anything else in life. If you're mostly doing the right thing,
exactly,
you can sometimes do the wrong
thing.
thing.
Like working out.
That's right.
Yeah.
Okay, so I might not be obsessed with it, but I know like tea's all about her teeth. Like we talk about teeth all the time. You look at people's teeth when you meet people and you love your teeth. What's your routine like?
I like a good set of piano keys, as I like to call them, right? I want them to look perfect. So I'm definitely a flosser. I floss twice a day. I don't feel like my teeth are clean if I am not flossing. It's a big deal to me. It's one of the first things I look at in a man.
I know.
Is his teeth clean? Do they look pristine? Like, that's a big deal to me. So I'm a huge flosser.
So you're out on a date, T, and he's like this, and he's really good looking, and he's like, hey! And it's
I'm
like,
done.
You're done.
I'm done. If he does one of these really big hard laughs, ha ha, and I see food and like tartar and all those things too, I'm out. Like I'm a big teeth person, so.
Yeah, I'm gonna be paranoid around you.
You have good teeth. You have good teeth.
Yeah, thank you. Well, maybe we should talk a little bit about our flossing routines, because you say there's a right way and a wrong way, right?
There is. I'd love to see what you're doing.
Okay, so I takes the floss.
All right, so far so good.
Okay, and I put it around the fingers.
All right.
And I go like this.
Uh-huh.
And I like this. It feels good.
That's great.
So you this way? Okay, so come on, that's enough of a close-up on my teeth. You see how close? Do you see how close together they are, though?
They are, yeah, that's good.
So that's like a journey every day. T, do you do yours the same sort of way?
I'm a huge flosser, but I don't believe I'm doing it correctly. I'm kind of just like a bang, 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 and I don't think that's correct.
Yeah.
So I'm about to learn.
If I wasn't on TV right now, I'd be doing it that way.
Yeah.
Bang,
bang, bang, bang, bang, bang, bang.
She's gonna say that's wrong. How should we be doing it?
You know what? If you're doing it at all and you're spending the time to do it, you might as well do it right.
Yes.
So I liked a lot about what you did, but I'm going to give you a few techniques to see if you can improve it.
All right.
Okay.
I'm open to that.
So a lot of people use less floss than they need.
Yeah.
So really what you want to do is take a nice, healthy, long piece.
Okay.
Kind of like shoulder length.
Yeah.
And then I want you to twirl it around your middle finger.
Ooh.
I saw you doing it around your index finger.
Yeah.
But middle finger's better.
Okay.
Because then you grab your index finger like this on the floss, and it gives you a lot more control.
Okay.
Got it?
Yeah.
So I'm going to need your help.
So
if
we're
you
going to
can
use
hold this model for me, please.
This is not an example of my teeth. These are bad teeth.
This is what you don't want happening to you.
This is what you don't want.
This is what happens when you don't floss.
Okay. So how do we do it the right way?
So you, like I said, you had your two index fingers around your floss right here like this. And then you're gonna go down. I saw you do this.
Yeah.
But now I want you to rub.
Oh.
Like a C shape even.
Okay.
Okay? And I want you to touch both surfaces of the neighboring teeth.
So you're going down and you're rubbing
you're
right
rubbing.
into that gum.
That's right. And you keep going.
Yeah.
I know it takes extra time, but if you're doing it, you might as well do it right.
Okay.
So you know when you're washing dishes,
Yeah.
and if you just rinsed it, it would not be clean?
That would be bad.
This is the same.
Okay.
So you gotta rub.
I don't even put my dishes in the dishwasher, so I should be a lot better about the teeth. Now, when you're doing that, do one again.
Yeah.
Like the gums seem to be, they're moving around
Yeah.
a lot. Is that good?
Well,
do they like that?
This is just a sample.
Okay.
This is what happens when you don't
Oh,
floss.
Lord. Put that back.
Right?
That's terrible.
This is what I show my patients when I really want them to floss.
Yeah, I get it.
But your gums shouldn't be flopping around.
Okay. All right. So that's the right way to do it. You've got to sort of take your time with it.
Yep.
Go down. Give it a little bit of
Yep.
a scrub. Right.
It's a part of your self-care.
It's a part of your
People
self-care.
are spending time on self-care. This is one component of it.
Now, is there anything you would suggest as a floss alternative? So don't skip the flossing, but if you cannot floss, there are people that might have joint pain in their fingers. Maybe they need an easier way to get in there.
Absolutely. So some people have big spaces in between their teeth.
Got it.
So this is called an interdental brush.
Yeah.
So what it is it's a tiny brush attached to a handle. It's really great for reaching those spaces. So I'll
Okay.
show you on the model like this. So you basically go in between the teeth and it goes like that.
It kind of looks like that feels good.
It does. It's like a
Right?
massage for your
Yeah.
gums.
Okay, so
Like
that's a
that.
good, easy way to do
Okay,
it.
and they come in different sizes. So
Okay.
big and small, medium. So whatever fits your teeth the best.
Okay.
So that's one thing.
Yeah.
Another thing is called a sulcus brush.
Okay.
So people who have like crowns and bridges and big fillings, this is really helpful as well.
Okay.
You can do the same thing and you rub up against the tooth.
Nice.
The idea is just to get rid of the plaque and germs.
Yes.
That's all.
I think we've got time for one more alternative.
Okay, and then water flossers are really popular now.
Yes.
So that shoots high pressure water at your teeth.
Yeah.
And that also dislodges big food particles.
Okay, good. You know what? I like that you're not judgmental. You come back here, Dr. Jeanie Luong. I like that.